Greetings. Welcome to my podcast, and thank you for tuning in. My name is Dr. Andrea Walker, and I am a board-certified family nurse practitioner, weight loss specialist, personal trainer, and IFBB professional figure bodybuilder. I am the owner of Dr. Andrea's Medical and Weight Loss Clinic located in Cordova, Tennessee, and the owner of Telehealth DNP, where I treat patients throughout the states of Florida and Arizona. In today's podcast, I will discuss Mounjaro, Zepbound, and Tirzepatide. Last week, I discussed Ozempic, Wegovy, and semaglutide. So if you missed it, make sure to go back and tune in because although I might mention those three meds in today's episode, they won't be the focus of today's podcast. But you will definitely want to make sure you understand those medications. It's just really hard to discuss Mounjaro, Zepbound, and Tirzepatide without mentioning Ozempic, Wegovy, or semaglutide. I say that because those three medications, Ozempic, Wegovy, and semaglutide, are what we call GLP-1s. And while Mounjaro, Zepbound, and Tirzepatide are also considered GLP-1s, they also contain an additional hormone known as a gastric inhibitory polypeptide, or GIP. I will get into that more in just a bit, but first, I will provide some background info on Mounjaro, Zepbound, and Tirzepatide. So let's get started. Mounjaro, whose generic name is Tirzepatide, received FDA approval in the United States for treatment of type 2 diabetes in May 2022. The manufacturer of the medication, Eli Lilly, designed the injectable medication to be used in conjunction with diet and exercise to improve blood sugar levels. Zepbound, whose name is also Tirzepatide, received FDA approval in the United States for the treatment of chronic weight loss in November 2023. The manufacturer of the medication is also Eli Lilly, the same manufacturer of Mounjaro. When taking Zepbound, it is recommended to inject the medication once a week as well as incorporate a reduced calorie diet and increase weekly activity, which means you should be exercising. Now, I will discuss Tirzepatide, which is the generic name for both Zepbound and Mounjaro. If someone is taking true Tirzepatide, then they are receiving the compounded version of the medication. Compounding pharmacies were allowed to start compounding Tirzepatide in December 2022, but only by compounding pharmacies who met certain conditions regulated by the Federal Food, Drug, and Cosmetic Act. Now, let me address this yet again. I addressed this in my first podcast. There is such a thing as counterfeit Tirzepatide, which you do not want. You will want to make sure you are purchasing compounding Tirzepatide from a reputable compounding pharmacy if you do not purchase the brand versions. Compounding is a legal practice in the United States that can be done by a licensed pharmacist in a state licensed pharmacy. When purchasing compounded Tirzepatide, it is important to choose a reputable compounding pharmacy based in the United States. Now, moving on. I will explain how the medications work in the body. If you listened to my podcast last week, I discussed Ozempic, Wegovy, and semaglutide, which are all GLP-1s, and I explained what that meant exactly. Well, as I mentioned earlier, Mounjaro, Zepbound, and Tirzepatide are not only GLP-1s, but they also contain the GIP hormone, so they have dual action. So, let's go over what GLP-1 means and its purpose in the body so you can get a full understanding of these three medications. GLP-1 stands for glucagon-like peptide, and it is a natural hormone produced in our bodies and released from cells in the intestines. Sometimes you will hear it called GLP, GLP-1, or GLP-RA, which stands for glucagon-like peptide receptor agonist. GLP-1 is a neuropeptide made up of 30 amino acids. These medications also contain a second hormone called GIP, which stands for gastric inhibitory polypeptide, as I mentioned earlier. This hormone is also produced in our bodies and released from the small intestines as well, just like the GLP-1 hormone. So, How does the GLP-1 portion we get from Mounjaro, Zepbound, and Tirzepatide work in our body? Well, it has several functions. It decreases our appetite. It increases signals to the brain, letting you know that you're full so that you won't overeat. It increases insulin sensitivity. It decreases or delays stomach emptying, which makes you feel fuller for longer. It decreases GI motility. It decreases glucagon secretions, and it increases insulin secretions. In addition to those benefits, you can also receive some cardioprotective benefits such as decreased risk of heart attack and decreased risk of cardiovascular death. Now I will share how the GIP hormone portion in Mounjaro, Zepbound, and Tirzepatide works in the body. It also decreases your appetite, increases insulin sensitivity, aids with fat metabolism, decreases stomach acid secretion, increases glucagon secretions, and increases insulin secretions. So both of these hormones are released after eating and play key roles in regulating blood sugar. But as you just heard, one of the significant differences in the hormones is that the GIP hormone has a significant role in metabolism fat, which I think we all want that. So the moral of the story is both of the hormones are natural hormones that our bodies are supposed to produce. But guess what? If our bodies do not produce them effectively or efficiently, injecting Mounjaro, Zepbound, or Tirzepatide as directed can replenish your GLP-1/GIP hormones and help with all the benefits I just mentioned that your body had not been getting, which would lead to better blood sugar control, weight loss, and fat metabolism, and all the other benefits I just stated. So, when you take Mounjaro, Zepbound, or Tirzepatide, you receive dual action because these medications bind to GLP-1 and GIP receptors, resulting in combined or dual effects. This is why research does tend to show more weight loss and improved A1Cs with this class of medications, the GLP-1/GIP, versus just the simple GLP-1s. Now, how are these medications dosed? These medications are all dosed the same across the board. Now, of course, your healthcare provider will adjust the dose according to goals, tolerance, side effects, etc. But Mounjaro, Zepbound, and Tirzepatide all have the same initial start dosage and max out at the same dosage. There are a total of 6 dosages, with 2.5 milligrams being the lowest dose and 15 milligrams being the max dose. Every 4 weeks, your healthcare provider can decide to increase your dose by 2.5 milligrams if needed. So that means it starts at 2.5 milligrams, then goes to 5 milligrams, and then to 7.5 milligrams, and then to 10 milligrams, then to 12.5 milligrams, with a max dosage of 15 milligrams. I know many patients will remain at the same dose for greater than 4 weeks because there is not a need to go up to the next dose every 4 weeks while being on these medications. I rarely ever max a patient out at 15 milligrams for treatment for weight loss on Tirzepatide, simply because it's just not needed, but everyone is different. Now, I will discuss who qualifies for the medication because not everyone will qualify. To be prescribed Mounjaro, it's very simple. You will need to have a diagnosis of type 2 diabetes. Now, while the manufacturer of the drug clearly acknowledges that people taking Mounjaro did lose weight, they also clearly state on their website that it is not a weight loss drug. So, for those healthcare providers who prescribe it strictly for weight loss, they are prescribing it for what we call off-label. And that's more than likely why it will be denied for coverage by your health insurance plan. Now, let's move on to who qualifies for Zepbound and Tirzepatide, which are the drugs indicated for chronic weight loss. So, with Zepbound and Tirzepatide, one must have a BMI of 30 or greater, or at least a BMI of 27 or greater, in addition to one other diagnosis such as PCOS, sleep apnea, hypertension, elevated cholesterol, prediabetes, or cardiovascular disease. Just like with Wegovy and semaglutide, of course, there may be other diagnoses that would qualify those with a BMI in between 27 and 30, but that would need to be discussed with your PCP on an individual basis. Now, let's discuss who won't qualify for any of the GLP-1/GIPs. You cannot take Mounjaro, Zepbound, or Tirzepatide if you or a close family member have a history of medullary thyroid carcinoma, if you have an endocrine system condition called multiple endocrine neoplasia 2 syndrome, if you are currently taking another GLP-1, if you have a history of gastroparesis, if you are pregnant, or if you are allergic to semaglutide. Now, I will discuss the black box warning that all GLP-1s and or GLP-1 GIPs contain. This is listed on the websites of Mounjaro and Zepbound, and it reads, may cause tumors including thyroid cancer. Watch for possible symptoms such as lump or swelling in the neck, hoarseness, trouble swallowing, or shortness of breath. If you have any of these symptoms, tell your healthcare provider. Sounds scary, doesn't it? Well, it is, but keep listening, it gets better. I discussed this in my podcast last week. I actually did a training with Novo Nordisk several years ago for a medication called Saxenda, which is also a GLP-1. The black box warning was discussed then. I had my concerns as well to the point I did my own research. Well, Novo Nordisk went on to say on their website that the studies were completed on rats and that it was not known if humans would develop thyroid cancer. But because the rodents did develop thyroid cancer, the FDA required the black box warning. The results of my own research could not find where any human cases were linked to the use of GLP-1s causing medullary thyroid carcinoma in humans. That was good enough for me, but it gets even better. A study was published in the British Medical Journal in April of this year, and the results concluded that in this large cohort study using nationwide data from 3 countries, GLP-1 receptor agonist use was not associated with a substantially increased risk of thyroid cancer over a mean follow-up of 3.9 years. I can remember the Novo Nordisk trainer telling me years ago, in a really nonchalant way, he was like, it was rats. Their brains are so different than ours. So that's that on that. The black box warning does remain, but I imagine it might be removed within a few years, but that's just my thoughts. Now I'll discuss things that may or may not allow you to qualify for the medication. But they are details that will definitely need to be discussed with your healthcare provider before deciding if the medications will be a good fit for you or not. They are, if you are currently taking a group of medications called sulfonylureas, if you have had any problems with your pancreas in the past or a history of pancreatitis, if you have a history of any type of kidney problems, if you have a history of diabetic retinopathy, if you are currently breastfeeding, if you are taking oral contraceptive, or if you have a history of depression or mental illness. Again, these are not absolute reasons that you will not be prescribed Mounjaro, Zepbound, or Tirzepatide, but further discussions will need to be had to determine if precautions should be in place, or maybe after discussing more in depth, your healthcare provider might decide the medication is not a good fit for you. I'll give you a few examples. For example, if you're taking birth control pills, it might be a good idea to consider switching over to a different form of contraception because Eli Lilly does state on their website that Zepbound might keep your oral contraception from working as well if you are taking the injection. I have heard of unexpected pregnancies while being on these medications, so you would not want that to happen. Then another example of why the conversations are needed. Maybe you are on one of the diabetic drugs, and then you're also taking one of the GLP-1/GIPs. And now your blood sugar may start to drop too low. So your blood sugar will need to be monitored very, very closely because maybe you will need to come off one or the other. So this is why having a good healthcare provider to monitor you closely and be aware of your past medical history will be super important for your success and safety. Now, I will briefly discuss the serious side effects for Mounjaro, Zepbound, and Tirzepatide. They are severe stomach problems, things like bowel obstruction, kidney failure, and this could be related to diarrhea, and that's severe diarrhea, nausea, severe vomiting, and severe dehydration, gallbladder problems, pancreatitis, serious allergic reaction, depression or thoughts of suicide, changes in vision, but especially in patients with type 2 diabetes, and low blood sugar. I will admit those all sound bad. I will not deny it. But if I can be honest, there is a reason why you need a licensed healthcare provider, such as an MD, NP, or PA, who will monitor your progress on a regular basis. You need a provider who checks in with you not just once a month, but ongoing throughout the month to make sure you are not having any issues. And if so, those issues can be addressed so that an intervention can be provided to possibly avoid one of the just mentioned serious side effects. This is why having a good healthcare provider is important when being on these medications. These are not just what I call treat and street medications. Meaning that we prescribe these medications and then we really don't see you anymore. Now I will discuss the more common and expected side effects. Some will be repeated, but some of the serious side effects were more so what could happen if the common side effects are not managed appropriately. And the common side effects are nausea, diarrhea, vomiting, constipation, abdominal pain, indigestion, injection site reaction, feeling tired, allergic reactions, belching, hair loss, and heartburn. Now, let me say this. Every single side effect I just mentioned came straight from Eli Lilly's website, and I am in agreement with it. But I will say this. I truly believe the potential for the hair loss is not necessarily a direct side effect from the injection, because anyone who loses weight and either loses it too quickly or does not eat a well-nourished / healthy diet while losing weight, or anyone who does not eat enough protein has the potential to have hair loss while losing weight. I was just discussing with a patient and she was like, yes, you are absolutely right. She shared with me about a model who started to lose her hair. Of course, we all know models watch what they eat, and many are what we would consider tiny. So I will throw this in right here. Please make sure you are eating your protein and eating a well-nourished diet. Protein will be your friend throughout your weight loss journey. So that's pretty much the basis of Mounjaro, Zepbound, and Tirzepatide. I'll wrap up with this. I treat patients on compounded semaglutide and Tirzepatide. Of course, for clarification, they are only on one or the other, but I will say this. I highly encourage my patients to come into the office weekly so that I can motivate them, but not only that, so I can really see how they are doing and follow up with them. But for those who do not come into the office weekly, and especially my telehealth patients, I make it a point to reach out to them on an ongoing basis to see how everything is going. My patients who are on compounded Tirzepatide rarely have the need to max out at the highest dose to achieve their weight loss goals. I try to be unbiased and present the facts, but I get this question all the time. Which is better, semaglutide or Tirzepatide? This is what I tell them. Research has shown for a while now, and even most recently proven, that Tirzepatide tends to be superior to semaglutide when it comes to weight loss, as well as improvement in A1C levels. And honestly, it makes sense because, as I stated earlier, Tirzepatide has the dual action and not only has the GLP-1 hormone, but also has the GIP hormone. However, I go on to tell my new patients that I honestly have more patients on semaglutide who have reached their goal weight than those on Tirzepatide. But also keep in mind, semaglutide has been out longer than Tirzepatide as well. So, with that being said, I think they both are great medications. I also tell them we can try one, and if they do not like it so much or cannot tolerate the side effects, we can always switch over to the other. Lastly, the only way I just flat out recommend Tirzepatide from the beginning is if my patient has a concern about their A1C in addition to wanting to lose weight as well. Otherwise, I present the facts and allow them to choose. Most have no problem choosing which one they will start with after hearing the facts. With that being said, I am sure you will feel the same way as well. I hope you enjoyed today's podcast. I truly love what I get to do, and I hope you learned something in today's podcast. Have a great week. Don't forget to meal prep, get to the gym, and I look forward to sharing another informative podcast with you next week. Take care.